Bedside shift report has been implemented at many hospitals in the Alina system. This process has proven to improve communication, save nurses time, and involve patients as partners in their care. At Abbott Northwestern, we will implement a modified version of Bedside shift report. On July 15th, we will start with introductions of the oncoming nurse and update of the care board. This will allow patients to ask questions and share important information. Like any new process, there are lots of questions and concerns about how it will work. This short video will demonstrate how to overcome some of the barriers and become efficient with the Bedside shift report. You will have a couple of tools to help you get started, and the use of these tools will be demonstrated in this video. One important tip is that you should try to wrap up your work as the end of the shift approaches. Free up your time to give Bedside shift report by finishing some tasks and then preparing to hand off other tasks to the next shift.
I see the last shift's assignment will be now posted on the desk for oncoming nurses to see. That Kyla had 2 of my patients overnight and Betty had the other 2. I'm going to take time from 7 to 7:15 to review my patients. Then I'm going to find Kyla and Betty to give introductions in the room and update the care boards at 7:15. I have looked over the cardiac MR and therapy schedule quickly and briefly. I'll have more time to look in depth later. Oh, there's Kyla and Betty. Betty, can I meet you in 5 minutes in 2319 for report?
Yes, see you then.
Kyla, do you have time to go report in 2310?
I do. I'm ready. Do you have your eye care tool, Kim?
I do.
Let's
You can
do
see
it.
that the eye care tool outlines things to cover in your Bedside shift report. The basic things include I, introduction, C, care board update, A, assess and look for abnormals, where you touch on abnormal assessment findings, R, reassess pain and plan, E, encouraging ending, where you wind up the discussion, ask the patient if they have any immediate needs, thank your coworker for sharing report, thank the patient for allowing you to care for them, and offer words of encouragement for their day. To start, we will only do the introduction. You should update the care board since you are in the room. To make a timely exit, you can use the encouraging ending step.
Hi, Joy. Hi. Good morning. This is Kim. She's going to be your oncoming nurse for the day.
Hi, I'll be a nurse until about 3:30 this afternoon.
Okay, great.
We're starting a new method of handing off care from one nurse to the next. Here's a handout that explains that in case you have any other questions.
Okay.
Kim is going to update the care board. She's going to write her name. The nursing assistant for today will be Searing.
Have you had any pain?
I'm not having much of a problem with it, really.
Okay, I'm going to write here that for you to remind you to ask for Tylenol if you start having any pain.
Sounds good, I'll do that. Oh, do you mind adding to put in hearing aids in the morning, every morning?
Of course.
Okay.
And we have those sitting here on your bedside table.
Oh, okay.
Would you like to put your glasses on this morning?
I would, thank you.
Joy does a great job of walking to the bathroom with her rolling walker.
Is she still using just an assistive one?
She is.
Okay.
Just a contact guard assist to and from.
Joy, is there anything else we can do for you today?
Well, I kind of need the restroom.
Do you think you'd be able to wait till the nursing assistant comes back in, or I'll come in first thing as soon as I start finish
Sure.
reading my information?
Sure.
Okay. I'm going to put the bed alarm on here just to remind you to call for help if you need anything, okay?
Thank you.
We'll see you in just a little bit.
Okay, thank you.
Thanks for letting me take care of you last night.
You're
Have a great
welcome.
day.
You too.
The patient in 2317 didn't want to be woken up for shift report. So I put that information in the new spot on our template in our sign-out report. It's the prior shift's responsibility to find out if the patient wants to be awoken for bedside shift report, and then put this information in the written shift report. Funny thing though, most of the patients are really happy to be included in the report and they don't want to miss out.
Well, I'll just meet up with Leanne in 2319 then. Leanne, I wanted to get a quick report on John.
Well, John's in therapy right now, Kim.
Well, can you just give me a quick update and I'll introduce myself to him later?
Sounds good.
Some things to be sensitive about during shift report include: pay attention to who does and doesn't want to be woken up. Don't barge in loudly. Patients may be resting at any time of the day and may be irritated by this. Don't ignore the patient and talk only to the other nurse. Also, don't talk about the patient in the third person. Include them in the conversation. Of course, don't say things that you would say that would only be said nurse to nurse, such as, "This family is nuts," or "This patient fakes their pain and is drug seeking," or 2327 wants, don't refer to the patient as a room number in their presence. This is common sense, and you will surely do an excellent job on this. Bedside Shift Report has been effective in improving patient satisfaction with nursing care, patients' opinions about the quality and amount of communication that occurs, and patients' feelings of involvement and control of their own care. There will be a suggestion list in the break room on a clipboard. Please write down questions that arise, problems that come up, problems that you have solved, and tips for coworkers on how to become successful at this process.